Hi, thank you. It's Abigail Newland. I'm the prevention specialist for Service Area 13. So I cover all of the counties in the top left hand of the screen. Caldwell, Mercer, Davies, Harrison, Grundy, Livingston, Putnam, Sullivan, and Lynn. Today we're just going to talk about Missouri Student Survey data and kind of where our findings are compared to 2018 and 2020. Out of all the substances that students were surveyed this year, alcohol was the top problem over prescription drugs, nicotine, and marijuana. Not that youth aren't using the other ones, but alcohol is perceived as the coolest substance among friends. Perception of harm is the highest. 30-day use is the highest, so that puts it as the leading problem. That's what we're most concerned about. But if we look at the data specifically, we talk about there's been a decrease in parents' perception of wrongness from 2018 to 2020. That's a social norm, these behaviors we want to change. Our increase in availability has went up 5% from 2018. It's getting easier and easier for kids to get alcohol, whether it's from their family, friends, people on the school bus, whatever it might be. We need to work on that. It's not good. The number of people who have tried alcohol in the past 30 days, that's increased in the past 2 years. And it is still higher than the other service areas, which means it's very concentrated in the middle northern part of the state. We really need to focus on that here in our area. Average age of first use, 12 and a half years old. We think that's fairly low considering the legal drinking age is 21, so that's something that we need to address. We look at 30-day use from 2018 to 2020, that is increasing. So 14.34% of students have used in the past 30 days. And it's increased quite a bit from 2018. We talk about parents who feel it would be wrong or very wrong to take 1 or 2 drinks of any alcoholic beverage nearly every day. That's 94.71%, and that has decreased from 2016, and it's 0.7% lower than the state average. So we don't want people, right, to think that it's right to take drinks of alcohol. So we look at more data. So we talk about availability is 1.9% lower than the state average. Peer approval, which means that their peers think that it's cool if they use the substance, if they drink. That's actually 4.1% lower than the state average. And then the risk of harm, right? Is it dangerous to drink? Is it wrong? Is it okay? And it's 4.2% higher than the state average. So again, that's a social norm we want to work on. We talk about these other ones. So availability, it has increased from 2018 to 2020, right? We go 45.3% here in 2018, and now we're up at 50%. So it's getting easier for kids to get that alcohol, and that's why it's increasing. That's why it's a top problem. So we got to pay attention, put some strategies in place. Peer approval, in 2018, it was 83.19. Go back to 2020. 72.3%, right? Kids think it's cool. There's no problem in alcohol. That's a problem in itself. 34.04% believe there's no or slight risk in drinking alcohol. That's a big, big number. Obviously, it means we talked about earlier that it's higher in the other service areas, but then I just said that it was lower than the state average. And so what this means is that it's just very concentrated in this service area compared to the others. We covered the 27 counties, so still a problem in all, very concentrated in this one. Some of this data is very alarming, so then you start thinking, what can we do about it? These are the effective strategies for change. There's 7 of them. This is what coalitions, this is what people can do on the ground level to help change some of these statistics, get kids, not thinking that alcohol is cool, to get parents to change their perception, etc. So the first one is providing information. This could be a range of things. Presentations, so it could be brochures, public announcements, PSAs, press release, billboards, anything like that. Any form of communication, we think about information dissemination is the goal. The next strategy is enhancing skills. Workshops would be the biggest one, but that could be anything. Distant learning, retreats, developing curriculum, whatever it might be. Training, learning, anything on that aspect. Providing support. That's very obvious. Coalitions are community-based. A lot of them are volunteers, working on partnerships. A lot of times we can't change things, such as the availability of alcohol, all alone. We have to include law enforcement. We have to include retailers. We might have to get the state involved at some level. Providing support means working together. The next one is enhancing access. And that could be access to a variety of things, healthcare, childcare, transportation, safety, making sure we have cultural and language sensitivity, whatever it might be. But identify those barriers and work on those that we can overcome. Some things we can't change, but some things there is room for improvement. The next one is changing consequences, and this seems to be the first go-to, especially when we think about alcohol, because most times people increase tax or they increase citations. There's fines, for parents that allow underage drinking at their homes, or fines for students that get caught. We talk about a minor in possession, loss of privileges, but it could be public recognition for deserved behavior. So coalitions or individuals that are making great efforts to combat this, that could be the other way around as well. Environmental changes, that could be parks, landscapes, signage, lighting, outlet destiny. So anything, right, making it where alcohol is not allowed on the premises, no drinking allowed, or maybe that there's an ID at every gate, things like that could be environmental changes. And the last one, and this one's really great, right, is changing policies. That could be workplace initiatives. This one really includes law enforcement, public policy actions, any kind of system change within the government, but this is at a community organization level. Changing policy changes how kids can access it. It changes a lot. So definitely a big one. These are all kinds of strategies that people can use. This is just some of the data. There's a lot more. We just wanted a brief touch on it. But if you want to get involved, you want to learn more, maybe you want to join a coalition and work on this, just send us an email at lowprevention@pfh.org and we'll get back to you. Thanks.